Hello everyone, welcome to Pave the Way. Today's episode is a very special one because this is based on this pandemic situation, the COVID-19 pandemic. And we have renowned Dr. Kuntal Bhattacharya with us, who is MD in medicine and DM in cardiologist, also gold medalist in the final year of the DM, and currently associated with R.N.Tagore hospital in Kolkata. And we will put the queries, some basic queries which we have in day-to-day life with regards to the pandemic situation or the COVID-19 infection, and we will get to know the answers from him, and hope it will help all of you. And I am pretty sure if you go through the whole session, it is kind 1 hour session almost, and it will help you, of course. Bhattacharya with us. Welcome, doctor. Welcome to the Pevdaway family. All the viewers, we will go through some few queries and the questions which we have generally in our mind during this pandemic situation, and which we generally looking for the answers. And we have our doctor here today, so we will ask the queries, and hopefully we will get all those answers today. And of course, don't forget to post your queries in the comment section so that we will get back to you if some questions are new to us. So, welcome, doctor.
Good evening, Atreo. Good evening, everybody. Thank you inviting me for this discussion on COVID, particularly in your platform, which you have started maybe 6 months back. And I can remember the days when you were down with this COVID, and it was quite serious issue at that time. So this COVID, actually, we have first witnessed this case in Wuhan, probably in 31st December 2019. After that, a long way we have come across, and probably we have already gathered enough information, and we have struggled enough in the second wave. So at present, probably we are waiting for the third wave. We don't know the reality. So we'll discuss a few questions which may be helpful for our viewers, particularly who are non-doctors. Let me clarify one thing, that I am a cardiologist, so I am not a COVID expert, but during this 1.5-year journey, I have come across many difficult cases of COVID in my hospital. Maybe I have gathered experience of almost 1,000 patients, and out of them at least 300 very sick or critically ill patients. So with that experience and whatever knowledge I have gathered from different studies, I want to share that. So Atri, you can go ahead with your questions.
Thank you for the briefing, doctor. So the first question is the symptoms to identify the COVID-19 infection. Is there any specific symptoms to look for, or it is now going in a wide direction?
So at the outset, I must say, when we saw the first wave and we witnessed the victims are having regular symptoms like fever, cough, or some kind of muscle pain, over a period of time, the spectrum of diseases and spectrum of symptom has increased many folds. So some of the patients may have typical symptom, like I told you. It could be a low-grade fever at the initiation. Later on second week onwards, the patient may have high-grade fever in the range of 102 degrees Fahrenheit. Sometimes patient have mild cough in the initial days. Later on, it could be severe cough, but most of the time, we notice that cough is without any expectoration. So in comparison to the other respiratory tract illness like pneumonia or bronchitis, the expectoration or the sputum production is much less in COVID cases. And second is headache or myalgia, muscle ache. Some patients will have a sense of palpitation or uneasiness during breathing. These are the initial first week symptoms. The second week onwards, the patient may have shortness of breathing along with symptoms of low oxygen. But most of the cases, the until oxygen is very less than 85%, the victim will not sense any major symptom. Only there will be symptom of weakness and cough and fever. That's all. Nowadays, we are getting some atypical symptoms like loose motions, maybe 4 or 5 times a day loose motions, and may or may not be associated with fever. Running nose is a very common symptom in the second wave, and particularly in some individuals who are on some immunocompressive drugs may not have a single symptom. A symptom could be, first symptom could be as loss of consciousness, or the patient may fell down at home or at bathroom. So these are few atypical symptoms. So most of the common symptoms are fever, cough, running nose, sneezing, and headache and myalgia. That's all.
Okay, thank you. So we are moving to the next one. What immediate steps to be taken if symptoms are for COVID?
This is a very important question. So in the first wave, there was a phobia regarding testing of COVID, because most of the time the corporation and municipality or any governing body, they are actually doing a very strict protocol for all these COVID victim. So they will restrict your movement, they will cordon the part of the flats, and you cannot move out. Neither you can get any help like your food or drinking purpose water. Everything will be very difficult to arrange for any patient or patient's party. So gradually, when we learned that this disease is actually not killing everybody, so maybe 5 to 10% patients who are getting affected by COVID are getting serious illness and requiring admission and hospitalization. So now we have learned that as soon as you developed any symptoms of cough, fever, or suggestive of COVID, you should go for a testing. That is the first thing. Once you tested yourself for COVID and you get a positive result, that indicates you need to isolate yourself, preferably in a room or in a house, and you should start your medication. That medication can be taken from your physician by online consultation, or you can go to a government hospital in a fever clinic and you can start your medication. As soon as the 5-6 days is over, and if still at that point of time you remain symptomatic, that is the point of major, I can tell that is the point of actually major concern, because at the second week, whenever it is a 7th day and you're still having fever and cough or respiratory distress, that indicates you need much more testing. So few parameters check is important. Likely I can tell you some blood parameters, some chest x-ray or some CT scan, which can help you to diagnose early whether you are getting any severe kind of illness or you need any further medical help or admission. So testing is very much important. Completion of your entire first course therapy or first week therapy is important, and then relevant investigation. If doctors or your medical attendant or physician thinks that you are getting any severe illness, then testing is, I think, required.
Okay. Thanks for this elaborate demonstration. So we are moving to the next question. In some cases, we have seen that RT-PCR is giving the negative report, but there are symptoms of COVID. So in that case, what is recommended? Should we think that it is? Yeah.
Yes, it is a very
Please.
practical question. So you think RT-PCR was advised for many purposes. Sometimes patients were given a RT-PCR test to identify whether he is having COVID or not. And for another person, the RT-PCR is required for joining his job, or he may want to travel abroad. So for that purpose, repeat testing is not required because we want a negative report in all those patients. But for identification of the patients, if we do RT-PCR, RT-PCR has got many drawbacks. First thing is sample collection method. So sample collection should be very strictly done and should be done with a lab person who is actually doing it regularly. So some amount of expertise is required. So it should be taken deep from the nasopharynx as well as from the throat. If you take it from a superficial swab, from the oral cavity or just in front of the nose, you may get a negative result. Second thing is your viral load. Suppose the patient is having high viral load and another patient is having low viral load. So getting a negative result in all those patients who are having low viral load is very common. Contrary to this, one thing you have to remember, when you have a low viral load, usually you have a lesser severe illness. It will not be very severe illness. So mild fever, maybe 1 or 2 days cough, then it is over. Sometimes, even after getting negative report, if your symptoms is much more severe, your fever is still there after 5 days, you are coughing profusely, then that is an indication of second test. So during this pandemic, any fever or cough, until or unless it is proved otherwise, whether it is RT-PCR positive or negative, you have to be taken seriously that you are having a COVID, and you have to maintain all the protocols of social isolation and etc. as a patient who is having COVID positive.
Okay. So we are moving to the next one. If RT-PCR is negative but symptom is there, so any other way to identify whether it is really COVID-19 positive or not?
This is a situation which we often come across during our day-to-day practice. So if a patient is having COVID negative and still having symptom of severe illness, so we need to do further more investigation. So a negative report, again I am telling, a negative report will not stamp that patient don't have COVID. So the patient requires further investigation, either radiological investigation in the form of chest X-ray or HRCT scan of thorax, where we may get a typical ground glass appearance of the lung parenchyma, and certain tests which are actually tests of inflammation like CRP, C-reactive protein, then coagulation, hypercoagulable. This COVID pneumonia is actually a hypercoagulable state. So there will be multiple thrombus or clot inside your different body capillaries, particularly in lung. So a marker which is known as D dimer is actually raised. Several other markers of inflammation like ferritin, LDH. So these are the markers by which you can diagnose the patient may have COVID. And if still these markers are negative, then you need to do another COVID test. Another COVID test, there are many type of COVID tests. The first test is probably a rapid antigen test. Sometimes we may get a wrong result. The another is very quicker test, which is known as TrueNAT test. The result is available in 1 to 2 hours period of time. But the most authentic test is still RT-PCR. So if RT-PCR is negative, then you go ahead with your second batch of RT-PCR test with the same patient after 72 hours if the patient remains symptomatic, and other battery of tests like I mentioned, C-reactive protein, LDH, ferritin, D dimer, and your CT scan of thorax or chest X-ray. So by that you can exclude the patient is really having COVID or other kind of pneumonia.
Okay. So the next question is a bit different. Now we know at least some sort of standard medical practice in case of COVID-19 infection, but the queries are like, what is the safer threshold of O2? Means after which threshold value one should visit the doctor or health center or hospital?
Okay, this is a very practical question for all patients, particularly who are COVID positive and isolating themselves in a room, or maybe he or she is staying alone in a flat. So oxygen saturation measurement is actually nowadays very much possible because of the availability and the cheap rate of the pulse oximeter. Probably before this pandemic, we don't have these access of all these pulse oximeter. Now we all have this pulse oximeter. So recommendation is, if patient is mild symptomatic, you don't require any measurement at home. If patient is having moderate symptom like continuous fever and cough on deep breathing, patient cannot lie down comfortably without having cough. This group of patient needs measurement of SpO2 or saturation, capillary saturation by pulse oximeter at home. And commonly we recommend at least 6 hourly record of pulse oximeter. And whenever the normal standard human being without any previous cardiac or lung ailment should have a saturation of 94%. So anything below that is abnormal. Now the method of measurement and the machine whichever you are using for your pulse oximeter your saturation measurement should be an ideal one. It should be without any fault. So you can cross check with your other family members whether it is giving a real correct reading or not, and then the patient himself can check it. Whenever it is below 94%, so 93% onwards, he needs some amount of more testing, or maybe he needs medical care or hospital admission. But you know that during this second wave, we have witnessed that the crisis of oxygen, the crisis of beds all over. Many patients require home-based oxygen therapy, and they recovered well by just domiciliary care and domiciliary treatment by his physician or hospital. So whenever you are having a low oxygen, that indicates your at least 50% or 40% lungs are involved, and they are not carrying the oxygen to your blood. So that indicates only 50% of your working lung is carrying the oxygen from the air to your blood. So at that point of time, you have a saturation of 92% or 93%. Within 1 hour period or 2 hour period, your oxygen can drop below 85% and it could be an emergency. So my suggestion will be, whenever you see your saturation is 93% or below that, you should get admitted, or you should at least consult your physician, or you should go to hospital for further checkup.
Okay, so moving to the next one, what all blood test reports are mandatory or necessary to be done, and what values to be checked for the alarming situation?
Okay, it is a quite bit of medical question. So for layman, I have already mentioned that for mild illness, you don't require any test except your RT-PCR. Until and unless you have any major past illness, like you are a person who are on therapy for cancer, or you are a diabetes, uncontrolled diabetes, or a cardiac patient who underwent previous cardiac surgery or any stent implantation. So this group of patients may need test even at milder symptom, but most of the patients with mild symptom don't need anything. They need only paracetamol for their fever remission, and probably some antihistaminic for their cough. That's all. Even after 1.5 years of gathering knowledge, now we have already formulated the guidelines for milder illness. Probably nothing is required. Probably ivermectin, doxycycline, all these antibiotics, nothing is required. So milder symptom, only paracetamol and cough suppressant. If more than milder symptom or moderate symptom, you should go for all those testings like I earlier mentioned. C-reactive protein, which is a marker of inflammation. It is a non-specific marker. It is actually CRP is increased in all kind of inflammatory disorders. Could it be pancreatitis? Could it be some abscess? Could it be some trauma? The CRP is high. Similarly, like ferritin, LDH is a marker which is a marker of cell damage. So anywhere there is cell damage, it could be a liver cell damage, it could be a lung parenchymal damage, you will get an increased LDH. And D-dimer. D-dimer is a very important marker and which actually guides you about the severity of the illness. And another is total count and differential count. So we do one thing, lymphocyte and neutrophil. A particular ratio is maintained in a normal person. These NLR ratio, neutrophil lymphocyte ratio, it gets altered in case of severe illness. Similarly, the ferritin gets very high. You will get a very high ferritin, high CRP, high D-dimer. High means it is more than 4 times, 5 times of the normal person. So these are the normal marker, and by that you can guess that my disease is severe. So if you get a very high marker, you need to take particular medicines which can check all these parameters, and you will get early relief from your COVID severity.
Okay. Thank you for the explanation. And the next one is this is the question on steroid. We have seen that steroid is very important. And what is the exact role of steroid in this recovery?
Okay, so first you have to understand about the COVID pathogenesis. Pathogenesis means how a disease affects human body. So whenever you inhale a coronavirus or COVID virus, it gets inside your body through your nasal mucosa or oral mucosa. Then it goes inside your bloodstream, and from that bloodstream, it will goes everywhere, and it start replicating within your cell, and gradually it particularly it damages the cells with a preference. So here the preference is lung parenchyma. So the lung cells are getting damaged. Suppose the patient is having hepatitis. Similarly, the patient may get a virus or hepatitis virus which will goes inside your body, then it will replicate and damage the liver cells. So similarly, it is a pneumonia causing virus. So pneumonia causing virus, usually the viral pneumonia affects much more severely than the bacterial pneumonia. The bacterial pneumonia usually affects a particular segment of a lung or portion of a lung. Normal pneumonia, whatever we talk about, it is a streptococcal pneumonia. It affects a particular zone of a lung. But this virus will affect the entire portion of your lung. So what we have learned during treating all those severely ill COVID patients, so these patients actually need much more anti-inflammation than a proper antiviral. As we don't have any particular antiviral against COVID, so the patients are actually dying because of inflammation inside the lung parenchyma or lung tissue. So we need a very potent anti-inflammatory drug. Now, steroid is a very potent anti-inflammatory drug. Wherever there is inflammation, the steroid will act. That is the beauty of all these chemically available steroids. So in our body, within our body, we produce steroid to tackle all our stress. Maybe the stress during exam, or stress during fever, or stress during our sports. But this chemically available steroid has got a beautiful anti-inflammatory property. As I told earlier, your CRP is raised, your ferritin is raised. These are all marker of generalized inflammation. So we have to suppress this inflammation to get a good result. So steroid will act as an anti-inflammatory drug. It is not an antiviral drug. And that is why the dose is almost equal, and it is according to the body weight of the person. So whatever steroid we are giving, whether it is a dexamethasone or methylprednisolone, these are all anti-inflammatory drugs. Apart from COVID, there are many other illnesses like bronchial asthma, some autoimmune disease like your inflammatory bowel disease or thyroid disease. There are many such kind of autoimmune disease where we have used this kind of steroid with a very good results. So with that knowledge, we have applied steroid in COVID and we are getting a good result.